5 medical tests seniors should question after age 70. Stop. Before you schedule another medical test, you need to hear this. What I'm about to reveal could save you from unnecessary surgery, prevent dangerous complications, and protect you from treatments that might do more harm than good. This isn't medical conspiracy theory. This is documented science that 99% of seniors never hear about. Here's the shocking reality. Recent medical research shows that nearly 40% of routine tests performed on adults over 70 result in treatments, procedures, or interventions that provide little to no benefit while exposing patients to significant risks. Even more alarming, one specific scan we'll discuss today is now linked to causing the same number of cancer cases as daily alcohol consumption, roughly 5% of all cancers in America. Your doctor won't mention this. Medical clinics don't advertise it. But today, we're pulling back the curtain on 5 commonly recommended medical tests that could be silently undermining your health after age 70. If this information could help someone you care about, please hit that like button right now and subscribe to our channel. We're about to dive deep into peer-reviewed research that challenges everything you thought you knew about preventative healthcare for seniors. And don't forget to share this video with family members who might benefit. Knowledge this important shouldn't stay hidden. Ready? Let's examine these 5 tests, starting with one that seems completely harmless, but can trigger a cascade of unnecessary treatments.
Test number 5. Bone density screenings, or DEXA scans. Picture this scenario. You walk into a medical facility, lie down on a comfortable table for 15 minutes while a machine quietly scans your bones. No pain, no injections, no discomfort. You leave with detailed information about your bone strength and fracture risk. Sounds like responsible healthcare, right? Here's what medical professionals often don't explain. After age 70, bone density screenings frequently create more anxiety and unnecessary interventions than actual health benefits. The DEXA scan, which stands for Dual Energy X-ray Absorptionometry, measures bone mineral density to assess osteoporosis risk. However, in older adults, particularly women, these scans almost universally reveal decreased bone density, even when no real fracture danger exists. Why? Because bone density naturally decreases with age, just like muscle mass, skin elasticity, or hair color. It's a normal part of human aging, not necessarily a medical emergency requiring intervention. Yet countless seniors receive these concerning results and are immediately prescribed powerful medications called bisphosphonates. These drugs, with names like Fosamax, Boniva, and Actonel, are designed to slow bone loss but carry serious side effects, including osteonecrosis of the jaw, a condition where jawbone tissue actually dies, severe esophageal irritation, and paradoxically, atypical fractures that occur in unusual bone locations. The scientific evidence tells a sobering story. A comprehensive study published in the Journal of the American Geriatric Society tracked over 1,200 women over age 70 for 5 years. The researchers found that bisphosphonate medications reduced actual fracture risk by a mere 0.3%, less than 1/3 of 1%. Meanwhile, participants experienced significantly higher rates of digestive problems, esophageal inflammation, and unusual bone breaks. Let me share Patricia's story. A 78-year-old retired librarian who loved gardening and had never experienced a fall or fracture. During a routine physical, her physician recommended a DEXA scan just to be safe. The results showed osteopenia, mild bone density reduction that doesn't even qualify as full osteoporosis. Within days, Patricia was prescribed alendronate, a bisphosphonate medication. 3 months later, she developed severe acid reflux and persistent jaw discomfort. She stopped gardening because bending over caused intense stomach pain. Her quality of life plummeted. When Patricia sought a second opinion, we immediately discontinued her medication and implemented a comprehensive lifestyle approach: targeted vitamin D supplementation, strength training exercises using resistance bands, and a calcium-rich diet emphasizing sardines, leafy greens, and dairy products. 12 months later, Patricia had returned to her garden, reported stronger legs and better balance, and had experienced 0 fractures. Most importantly, she felt like herself again. Current research published in Osteoporosis International demonstrates that lifestyle interventions, strength training, balance exercises, proper nutrition, and vitamin D optimization reduce fracture risk by more than 20%, far exceeding medication benefits while avoiding pharmaceutical side effects. The takeaway? If you're over 70 and haven't experienced falls or fractures, consider whether a DEXA scan will genuinely improve your health or simply generate anxiety and unnecessary treatments.
Test number 4. Brain MRI for memory concerns. Memory lapses in older adults often trigger immediate fear of dementia, Alzheimer's disease, or cognitive decline. When seniors express these concerns, physicians frequently order brain MRIs, believing detailed imaging will provide answers and peace of mind. Unfortunately, the opposite usually occurs. Brain MRIs in adults over 70 typically reveal age-related changes, mild brain shrinkage, or small white matter spots called hyperintensities that represent normal aging processes, not disease states. However, once these findings appear on radiology reports, they can trigger a dangerous cascade of fear, additional testing, and even invasive procedures. A landmark 2021 study published in Neurology Today analyzed over 3,000 brain MRIs performed on patients aged 70 to 85 who reported mild cognitive complaints. The results were striking. 86% showed some form of brain abnormality, but only 3% of these findings represented actually treatable conditions. This means 97% of patients endured the emotional trauma of hearing "there's something wrong with your brain" when nothing was actually wrong. Worse, nearly 12% were subjected to invasive follow-up procedures like spinal taps or brain biopsies based on these benign scan results. Consider Harold, a 76-year-old retired accountant who sought medical attention because he occasionally misplaced household items and sometimes forgot acquaintances' names. He remained mentally sharp, continued managing his finances, and maintained an active social life. However, his physician ordered a brain MRI to rule out dementia. The scan showed white matter changes consistent with normal aging. Harold panicked, convinced he had Alzheimer's disease. He stopped driving, avoided social gatherings, and became increasingly anxious and depressed. His family watched helplessly as their vibrant patriarch withdrew from life. When Harold sought our consultation, we administered a standardized cognitive assessment. His scores fell well within normal ranges for his age group. We explained that his MRI findings were age-appropriate and not indicative of dementia. We focused on lifestyle factors that support cognitive health: quality sleep, proper hydration, mental stimulation, and stress reduction. Within 3 months, Harold's memory concerns had stabilized and his confidence returned. He resumed driving, rejoined his book club, and felt mentally sharp again. The medical evidence is clear. Unless seniors exhibit severe neurological symptoms like seizures, dramatic personality changes, or rapid functional decline, brain MRIs for mild memory concerns rarely provide helpful information and often cause unnecessary distress. A more appropriate first step is cognitive screening. simple paper-based tests that evaluate memory, attention, and problem-solving abilities. These assessments are inexpensive, effective, and avoid the risks of unnecessary panic associated with brain imaging.
Test number 3, cardiac stress testing. Cardiac stress tests rank among the most frequently ordered procedures for seniors experiencing fatigue, mild chest discomfort, or general feelings of not being myself. These tests, which monitor heart function while patients exercise on treadmills or receive medications that simulate physical exertion, are designed to detect blocked coronary arteries. However, after age 70, stress tests often cause more problems than they solve, particularly when performed on individuals without clear cardiovascular symptoms. The primary issue lies in accuracy. Research demonstrates that in adults over 70, cardiac stress tests produce false positive results, indicating problems that don't actually exist in up to 40% of cases. These false alarms lead to unnecessary follow-up procedures like cardiac catheterizations, angioplasms, and coronary stent placements. A major 2017 study published in JAMA Cardiology revealed that more than half of all cardiac stents placed following stress test recommendations were performed on patients who showed no real symptoms or derived no measurable benefit from the procedures. These patients didn't experience improved survival rates or better quality of life. Instead, they faced higher rates of bleeding complications, kidney damage from contrast dyes, and extended hospital stays. This exact scenario affected Thomas, a 77-year-old retired mail carrier who maintained his health through daily neighborhood walks. During a routine checkup, Thomas mentioned feeling slightly winded when climbing steep hills. His physician immediately scheduled a cardiac stress test just to be cautious. The test results were inconclusive, prompting a cardiac catheterization, a procedure involving threading tubes through arteries to visualize potential blockages. Doctors discovered mild arterial narrowing and inserted a cardiac stent. That evening, Thomas experienced an allergic reaction to the contrast dye and developed kidney complications. He spent 6 days hospitalized and required weeks of follow-up care. The irony? Thomas's original fatigue wasn't cardiac-related at all. He simply needed better hydration and more frequent rest periods during physical activity, issues that resolved with simple lifestyle adjustments. For adults over 70 without classic cardiac symptoms, such as chest pain during activity, significant shortness of breath during exertion, or dramatic energy drops during light exercise, stress testing may create more risks than benefits. Safer alternatives include resting electrocardiograms, or EKGs, which assess heart rhythm without physical stress, or coronary calcium scans, which use minimal radiation to detect dangerous arterial plaque buildup. These options are less invasive and far less likely to trigger unnecessary procedures.
Test number 2, routine colonoscopy screening. This recommendation might surprise you, but routine colonoscopy screening, the procedure using a flexible camera to examine the entire colon, isn't always wise after age 70 and is rarely recommended after 75 unless specific symptoms are present. The risks associated with colonoscopy increase significantly with age. The preparation process involves powerful laxatives that can cause dehydration, dizziness, electrolyte imbalances, and kidney problems in older adults. The sedation required during the procedure poses additional cognitive risks for seniors. Most concerning, the procedure itself can cause serious complications, including internal bleeding, bowel perforations, and heart rhythm disturbances during sedation. A comprehensive 2019 study published in JAMA Internal Medicine followed 1.3 million Medicare patients aged 70 and older. The researchers discovered that for every 1,000 colonoscopies performed in patients over 75, only 2 lives were saved through early cancer detection. However, more than 20 patients experienced serious complications, a 10-to-1 risk-to-benefit ratio. Even when polyps are discovered, many are small and slow-growing. In older adults, removing these polyps sometimes causes more harm than leaving them undisturbed. Consider Margaret, a 74-year-old grandmother who operated a small flower shop with her daughter. She had no symptoms, no rectal bleeding, no changes in bowel habits, and no family history of colorectal cancer. However, her newly assigned primary care physician, recently graduated from medical residency, strongly urged routine colonoscopy screening. Margaret reluctantly agreed. During the procedure, doctors removed a small polyp and discharged her home. That night, she experienced severe abdominal pain and lost consciousness. Emergency room physicians discovered a bowel perforation requiring immediate surgery. Margaret spent 9 days recovering, lost 12 pounds, and never fully regained her previous energy level. Upon reviewing her medical history, we discovered Margaret had already undergone 2 previous colonoscopies with normal results. There was no medical justification for repeating the procedure. The U.S. Preventive Services Task Force currently recommends discontinuing routine colorectal cancer screening at age 75 for most individuals. For healthy older adults, home-based stool tests like the FIT, fecal immunochemical test, offer safer alternatives. These tests require no preparation, no sedation, and still detect most concerning cases while avoiding procedural risks. Always discuss alternatives with your physician, because once you enter the colonoscopy screening cycle, it becomes increasingly difficult to stop.
Test number 1. Full-body CT scans. We've reached the most overused, most dangerous, and most potentially harmful screening test for seniors. And you've almost certainly encountered marketing for these procedures. Full-body CT scans are often marketed through executive health packages or private clinic preventative services, promoted as comprehensive ways to detect cancer early. The marketing sounds appealing. Catch problems before symptoms appear, or complete health assessment in one visit. Here's the terrifying truth. These scans expose your body to massive doses of ionizing radiation while providing 0 proven health benefits for asymptomatic individuals. For adults over 70, the likelihood of triggering unnecessary follow-up testing, biopsies, and surgical procedures is extraordinarily high. Each full-body CT scan delivers 10 to 20 millisieverts of radiation, equivalent to approximately 500 chest X-rays. According to a 2023 modeling study published in JAMA Internal Medicine, the dramatic increase in CT scan usage across America may now cause up to 5% of all cancer cases, making medical imaging as significant a cancer risk factor as daily alcohol consumption. Think about that statistic. 1 out of every 20 cancers could be caused by a scan supposedly designed to prevent disease. This isn't just counterproductive, it's genuinely dangerous. These scans frequently detect harmless nodules, calcifications, or cysts that represent normal aging processes. However, once these findings appear on reports, they trigger alarm bells. More scans follow, then biopsies, then panic and anxiety. Let me tell you about Robert, an energetic 82-year-old who taught Tai Chi to fellow seniors at his community center. He felt fantastic and decided to participate in an executive health screening at a prestigious private clinic. His full-body CT scan revealed a tiny 3-millimeter lung nodule. This discovery launched a medical avalanche. Robert was referred to oncology specialists, underwent PET scans, and eventually endured a needle biopsy. The final result? Completely benign tissue. However, the biopsy procedure collapsed part of his lung, requiring hospitalization and 2 months of recovery time. All for something that should have been left alone. Medical experts now unanimously advise against full-body CT scans for general screening in healthy adults.
The American College of Radiology states clearly, there's no proven benefit and significant potential for harm. If you have specific symptoms like unexplained weight loss, persistent coughing with blood, or visible masses, then targeted imaging makes perfect sense. But scanning your entire body without focus is like searching for buried treasure with a metal detector in a minefield. You might find something, but the damage could exceed any potential benefit.
The smarter approach to senior healthcare. A safer, more intelligent approach involves listening to your body and maintaining open communication with a trusted primary care physician. If you feel well and maintain good function, resist pressure for unnecessary screening tests that aren't clearly indicated by symptoms or risk factors. Real health prevention for seniors starts with lifestyle factors, staying physically active through appropriate exercise, eating nutrient-dense foods, prioritizing quality sleep, managing stress effectively, and maintaining social connections. These interventions provide far greater health benefits than most screening tests, while avoiding potential complications. Your next steps. Before agreeing to any medical test, ask these critical questions. What happens if this test finds something abnormal? What are the specific risks and benefits for someone my age? Are there safer alternatives that provide similar information? What would happen if we waited and monitored instead? If the answers are unclear or if the risks outweigh potential benefits, consider pausing to seek a second opinion. We want to hear from you in the comments below. Have you or someone you loved faced complications from a medical test that turned out to be unnecessary? What was your experience? Your stories help other viewers make informed decisions about their healthcare. If this information was valuable, please give this video a thumbs up and subscribe for more evidence-based health content. Share it with family members who might benefit from this knowledge. Information this important shouldn't remain hidden. Remember, modern medicine is incredibly powerful, but it's not perfect. Sometimes less truly is more. Your time, energy, and health are too precious to waste on fear-driven screening that might leave you worse off than when you started. Stay informed, stay healthy, and choose your medical tests wisely.